Quote for today is have more than you show, speak less than you know. Today we are going to discuss influenza, a comprehensive overview. I am Dr. Mohammed Awais Gill, and I am giving this presentation under the supervision of Professor Dr. Saira Afzal. Today we will learn about that influenza is a highly contagious respiratory illness with significant global impact. This presentation covers epidemiology, clinical features, prevention, and control strategies, and it emphasizes on vaccination, public health challenges, and global and local perspectives will also be presented. And the aim of this presentation is to equip healthcare professionals with knowledge to manage and prevent influenza effectively. Now, first we will discuss about the virology and its pathogenesis. First of all is the virus structure. Influenza viruses are enveloped RNA virus with a distinctive structure. They possess a spherical shape and contain hemagglutinin and neuraminidase surface proteins. These proteins are crucial for the virus's attachment to and entry into the host cell. The influenza virus is classified into types A, B, and C. Type A is responsible for seasonal epidemics and pandemics. Now the pathogenesis. Influenza viruses replicate in the respiratory epithelium, causing cell damage and inflammation. The immune system's response to the viral infection leads to the production of cytokines, which contribute to fever and muscle ache. The virus can also spread to the lungs, potentially resulting in pneumonia. Now, the epidemiology and the epidemiological triad, the agent, host, and the environment linkages. The agent is influenza viruses, primarily type A and B, that are responsible for seasonal epidemic. The virus's ability to mutate and evolve contributes to its continued circulation and emergence of new strains. The host factor. Women's susceptibility to influenza viruses based on age, health status, and immune response. Factors like the environment factor. Factors such as temperature, humidity, and population density can influence influenza transmission. Crowded environments, poor ventilation, and cold weather favor viral spread. Now, the clinical presentation and the complication. The symptoms of the influenza infection are fever, muscle aches, chills, rhinitis, cough, weakness, diarrhea, vomiting, fainting, sore throat, and headache. And the complication that it can lead to these are pneumonia, bronchitis, ear infections, and sinus infection. In some cases, influenza can lead to more severe complications such as encephalitis, myocarditis, and can also lead to the death. These are the some complications. These are the neurological, like the confusion, headache, and fever. Respiratory complications include dry cough, sore throat, and nasal congestion. Gastrointestinal complications include nausea, vomiting, and diarrhea. Musculoskeletal complications include myalgia and fatigue. And the complications that it can lead to are febrile convulsions, Reye's syndrome, meningitis, encephalitis, transverse myelitis, and GB syndrome. The cardiac manifestations are pericarditis, myocarditis, exacerbation of cardiovascular disease. Respiratory complications are otitis media, throat, sinusitis, bronchitis, meningitis, pneumonia, and exacerbation of the existing chronic lung diseases. In pregnancy, it can increase maternal complication, increase infant perinatal mortality, increase risk of prematurity, smaller neonatal size, and low for weight babies. So the social determinants of influenza are related to housing, that access to safe and adequate housing, including ventilation, reducing corroding, and promotes hygiene practices. The education factors are higher education levels correlate with better understanding of influenza prevention and health-seeking behaviors. The income, low income limits access to healthcare, nutrition, foods, and preventable measures like vaccination. Healthcare access, limited healthcare access can delay diagnosis, treatment, and access to vaccine, potentially increasing the complications. No, the chain of transmission. The source is an infected person, typically with symptoms or even asymptomatic individuals. The mode of transmission is primarily via respiratory droplets, released through coughing, sneezing, or talking. The susceptible can be anyone who comes into contact with the infectious droplets, particularly those with weakened immune responses. The diagnosis of influenza can be made on clinical evaluation, rapid antigen tests, and molecular testing. Clinical evaluation involves a thorough history taking and physical examination that are essential to identify potential influenza cases. Rapid antigen tests are available at facilities and pharmacies that provide quick results but can have lower sensitivity. The molecular testing is reverse transcriptase PCR are more sensitive but may take longer to produce results. And this is the gold standard for diagnosing the influenza infection. So the treatment options for influenza include the supportive care, antiviral medications, and hospitalization. Supportive care includes rest, plenty of fluids, over-the-counter medications to manage symptoms are crucial for managing mild influenza cases. Antiviral medications include oseltamivir and zanamivir that can shorten the duration of illness and reduce complications, especially when started within 48 hours of symptom onset. The next is hospitalization. Hospitalization is recommended for severe influenza cases with complications like pneumonia, dehydration, or difficulty in breathing. So the FDA approved antivirals and CDC recommendations. FDA approved these drugs, oseltamivir and zanamivir. Oseltamivir is neuraminidase inhibitor available in oral suspension and capsule formulation, while the zanamivir is another neuraminidase inhibitor, but it is administered by inhalation. Now, coming towards the influenza prevention, control, and public health strategies. So, there are three levels of prevention: a multi-layered approach that is primary, secondary, tertiary, and quaternary prevention. Primary prevention focuses on preventing the initial occurrence of influenza. This includes measures such as vaccination, hand hygiene, avoiding close contact with infected individuals, and it aims to reduce the risk of contracting the virus altogether. The secondary prevention aims to stop or slow the progression of influenza once it's already present. This can include early detection and treatment, antiviral medications, and isolation of infected individuals to minimize the spread. Tertiary prevention includes on managing long-term consequences of influenza infection. This includes rehabilitation, managing complications, and reducing disability associated with influenza. Quaternary prevention is the new concept that involves preventing overtreatment, avoiding unnecessary medical interventions, protecting patients from potential harms of interventions. It ensures the benefits of interventions outweigh the potential risks. Now, the influenza vaccines. That is a powerful weapon against the virus. The vaccines reduce the risk of infection. Influenza vaccines are highly effective in reducing the risk of contracting influenza, hospitalization, and death, particularly in vulnerable populations like the elderly and the young children. It protects against complications. Vaccines significantly reduce the risk of complications associated with influenza, that are pneumonia, bronchitis, ear infections in high risk groups. And it decreases the spread of virus. Vaccinated individuals are less likely to spread the virus to others, helping to protect those who cannot be vaccinated, like newborns and individuals with compromised immune system. No, these are the high-risk population, that are children and infants, adults whose age is above 65 years, and the pregnant woman. No, the vaccine is available in the flu shot that is given injectably, and the nasal spray flu vaccines. So why a yearly flu vaccine is necessary? The shifting landscape for influenza. First reason is that it has an evolving strain. Influenza viruses are constantly evolving, leading to the emergence of new strains. Yearly vaccination helps to ensure that individuals have adequate protection against circulating strains. The seasonal flu pattern. Flu season occurs annually, typically during the fall and winter months. Most probably during the start of winter, like the start of the December. Vaccination provides protection during peak transmission periods, minimizing the impact of virus and the boosting of the immune system. The yearly flu vaccine helps the immune system remember how to fight off the virus, making it more effective in future encounters with influenza. Now, the contraindications to influenza vaccination, understanding safety. These include severe allergic reactions, severe fever, and acute illnesses. Individuals with severe allergic reactions to egg proteins or other vaccine components may have contraindications to vaccine. Severe fever. If someone is experiencing a high fever, vaccination should be postponed until they recover. And during the acute illness, vaccination is typically delayed if individuals are experiencing a serious illness or the patients are immunocompromised and their immune system may be weakened. So the influenza vaccine market size and growth analysis by 2030. A 2030 booming industry. The global influenza vaccine market is expected to witness the significant growth in coming years, driven by factors such as increasing aging population, rising awareness of influenza risks, and development of new and improved vaccines. Number second is the market is projected to rise during the forecast period. Key growth drivers include increased demand for influenza vaccine in emerging markets, advancements in vaccine technology, and government initiatives to promote vaccination programs. The market segmentation includes different vaccine types like inactivated influenza vaccines, live attenuated influenza vaccines, Recombinant influenza vaccines. The market is also segmented by distribution channels, including hospitals, clinics, pharmacies, and online platforms. Now, the research and innovations in vaccine development, advancing flu protection. First is universal influenza vaccine. Researchers are actively working on developing the universal influenza vaccine that would provide long-lasting protection against a broad range of influenza strains, limiting the need for annual vaccination. Second is nasal spray vaccine. Nasal spray vaccines offer a convenient and potentially more effective delivery method, particularly for children, compared to traditional injectable vaccines. The vaccines stimulate immune responses in the nasal passages where the virus enter the body. The next is adjuvanted vaccine. Adjuvanted vaccine contain an additional ingredient called an adjuvant, sorry, which enhances the immune response to vaccine, potentially leading to greater protection and longer lasting immunity. The last is antiviral medication. Research continues to focus on developing new antiviral medication that can effectively treat influenza infections, reducing the complications and the severity of the infection. Now, the public health challenges in vaccination efforts, overcoming barriers. The first challenge in vaccination is vaccine hesitancy, access and equity, misinformation and lack of trust, and cost and insurance coverage. Influenza vaccination efforts face numerous public health challenges that require strategic interventions. One major hurdle is top of the list is vaccine hesitancy. That is driven by factors like misinformation, mistrust of vaccines, concern about potential side effects. Addressing these concerns through education and community outreach is crucial. No, National Influenza Vaccination Week, raising awareness and promoting vaccination. The National Influenza Vaccination Week is celebrated on first week of December. Its importance is that it is celebrated annually that aims to raise public awareness about the importance of influenza vaccination and encourage individuals to get vaccination. The activities include various activities that are organized during National Influenza Vaccination Week, including media campaigns, public health messaging, vaccination clinics, and community events to promote vaccination uptake. The goals of National Immunization Vaccination Week include increasing influenza vaccine rates, protecting vulnerable populations, and reducing the burden of influenza on healthcare systems. Influenza vaccination trends in Pakistan. A country-specific perspective. Pakistan had made progress in influenza vaccination, but there is room for improvement. Factors influencing vaccination rates include socioeconomic factors, access to healthcare, and vaccine availability. Efforts are ongoing to strengthen vaccination programs, promote awareness, and address barriers to vaccination. Know the global influenza, insight, strategies, and role of artificial intelligence. Annual global incidence of influenza. Influenza is highly contagious respiratory illness that affects people globally. The World Health Organization estimates that annually there are 3 to 5 million severe cases of influenza worldwide, resulting in 290,000 to 650,000 respiratory deaths. The numbers highlight the significant burden influenza poses on global health, particularly in vulnerable populations. It underscores the importance of ongoing monitoring, robust surveillance system, and effective preventive measures, including vaccination. This is the diagram that shows the annual global incidence of influenza vaccination, that is up to 30% of all children and up to 10% of all the adults. Know the morbidity and mortality related to influenza. Seasonal patterns. Influenza typically exhibit seasonal patterns with peaks occurring during winter months in temperate regions and year-round transmission in tropical climates. These patterns can vary due to factors like population density and geographic locations. And second is the high-risk groups. Certain individuals are at higher risk for complications from influenza, including young children, older adults, pregnant women, and those with underlying medical conditions. These groups are a priority for vaccination and timely medical attention. And the third uh, 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 cause is economic impact. Beyond direct mortality, influenza has a substantial economic impact, leading to loss of productivity, healthcare expenses, and disruptions in the daily life. Effective prevention and control measures can help mitigate these costs. Now, coming towards the pandemics related to the influenza infection, the first pandemic that is was reported is in 1918 and it leads to 50 million deaths globally. The second pandemic that rises is in the year 1957, that is Asian flu pandemic that leads to 1 million deaths. The third pandemic that rises is Hong Kong pandemic that rises in 1968 and it leads to 1 million deaths. The fourth pandemic arises in 2002, that is SARS epidemic that leads to approximately 774 deaths. Then is the 2009, that is H1N1 pandemic that leads to 284,000 deaths. The next is in 2012 that causes 858 deaths, that is MERS epidemic. And in 2019, COVID-19 pandemic arises that leads to millions of deaths worldwide. The historical perspective of flu pandemics from 1918 to 2019. The first pandemic that rises is 1918, that is Spanish flu. In 1918, Spanish flu pandemic was one of the deadliest human history. It infected an estimated 500 million people worldwide and resulted in 50 to 100 million deaths. The pandemic highlighted the profound impact influenza can have on global health and the need for post-pandemic preparedness strategies. The second is in 1957, that is Asian flu. The Asian flu pandemic in 1957 infected an estimated 1.1 billion people worldwide and caused an estimated 2 million deaths. It underscored the importance of rapid vaccine development and global coordination in response to emerging influenza threats. The third is in 1968, that is called the Hong Kong flu. The Hong Kong flu pandemic in 1968 infected an estimated 1 billion people worldwide and caused an estimated 1 million deaths. It demonstrated the need for ongoing surveillance and research to understand evolving influenza strains and develop effective vaccines. The fourth one is 2009, that is called the swine flu. In 2009, swine flu pandemic, also known as H1N1, infected an estimated 1.4 billion people worldwide and resulted in 150,000 to 575,000 deaths. It highlighted the importance of early detection and prompt response to emerging influenza threats. No, these are the pictures from 1918 to the ongoing, which has shown that the healthcare workers who are wearing personal protective equipments, and these are the dead bodies who are the victims of the influenza viruses. No, the Global Influenza Surveillance and Response System, that is abbreviated as GISRS. GIS is a global network that collects and analyzes influenza data from around the world. This collaboration provides a critical insights into influenza trends and helps inform public health responses. Early detection. GISRS plays a crucial role in early detection of influenza outbreaks, allowing for timely intervention to prevent further spread and minimize the impact on public health. The next is vaccine development. The data collected through GISRS helps inform the development of influenza vaccines, ensuring that they are effective against circulating strains and provide optimal protection against disease. Speedier development, as seen in COVID-19 vaccines, now apply to influenza vaccines. Now, the Global Influenza Strategy 2019 to 2030. The goal is to reduce the global burden of influenza through effective surveillance, prevention, and control measures while strengthening pandemic preparedness. Its objective is to increase the global influenza vaccination coverage, strengthen the surveillance system, and improve access to antiviral medications. The strategies that include is to promote collaboration among countries, enhance research and development, and raise public awareness on influenza prevention measures. The key actions taken are to implement national influenza control plans, promote seasonal vaccination, and ensure access to antiviral treatments. The outcomes are to reduce influenza-related morbidity and mortality, improve pandemic preparedness, and minimize the socio-economic impact of influenza. Now, the influenza in Pakistan, the data, strategy, and health advisory related to the Pakistan. The data analysis. Pakistan has a significant burden of influenza infection with an estimated 10 million cases reported annually. This highlights the need for robust surveillance systems to monitor the prevalence and spread of influenza strains in the country. The strategies that the Pakistan is adopting is the Pakistan government has implemented a National Influenza Control Program, National Influenza Control Program to mitigate the impact of influenza. This program focuses on promoting vaccination, early detection, and prompt treatment to minimize disease severity and complications. The next is health advisory. Public health messages are essential to raise awareness about influenza prevention, including the importance of hand washing, respiratory etiquettes, and vaccination. The messages should be tailored to specific population and cultural context. Know the case studies and the lessons learned. Outbreak response. Case studies of past influenza outbreaks that I have already shown from 1918 to 2019. The outbreaks provide valuable insights into how different countries responded to the challenge of disease spread and the effectiveness of various control measures. The next is vaccination campaigns. Analyzing the success and challenges of vaccination campaigns can inform future strategy for increasing coverage of maximizing the impact of influenza vaccines in different populations. The next the lessons learned is from the antiviral treatment. Case studies on the use of antiviral medication for influenza treatment offer insights into their effectiveness, optimal timing of administration, and potential side effects. From the public health data on influenza, global and related to the Pakistan. Approximately 10 million cases are estimated annual influenza cases in Pakistan. 500,000 hospitalization estimated annual influenza-related hospitalizations in Pakistan, and 10,000 deaths estimated annual influenza-related deaths in Pakistan. Know the role of artificial intelligence in outbreak detection. Artificial intelligence models for predicting influenza outbreaks using real-time data from the social media and weather patterns and from other sites like the Google Flu Trends and the Global uh, Global Initiative for Global Influenza Surveillance and Response System and integrating artificial intelligence tool. This helps in predicting the outbreak of the influenza. Now coming towards the recent updates. First article is development of pentavalent broadly protective nucleoside modified mRNA vaccine against influenza B viruses. Messenger RNA viruses vaccines represent a new effective vaccine platform with a high capacity of rapid development. Generation of a universal influenza virus vaccine with the potential to elicit long-lasting, broadly cross-reactive immune response is necessary for reducing influenza-associated morbidity and mortality. Here we focus on the development of a universal influenza B virus vaccine based on lipid nanoparticle encapsulated nucleoside modified mRNA platform. They evaluate vaccine candidates based on different target antigens that afford protection against challenge with ancestral and recent influenza B viruses from both antigenic lineages. A pentavalent vaccine combining all tested antigen protect mice from morbidity at a very low dose of 50 nanogram per antigen after a single vaccination. These findings support the further advancement of nucleoside modified mRNA LNPs expressing multiple the conserved antigens as universal influenza virus vaccine candidates. Now, the second article is the effect of monovalent influenza vaccine on the risk of hospitalization and all-cause mortality, according to the results of randomized controlled trials. This is a systematic review and meta-analysis. The objective of this study is aimed to investigate the effect of monovalent flu vaccine on the risk of hospitalization and all-cause mortality. The methodology is this study was a systematic review of the randomized controlled trials that are published between uh, 1980 to December 22, and the databases that were searched are Web of Science, Scopus, PubMed, Cochrane, ScienceTech, and Google Scholar. All analyses were performed by Stata 15 statistical software, and significance level in the study was considered 0.05. The results show that the overall odds ratio of hospitalization is equal to 0.71. P-value is less than 0.01, and the overall odds ratio of all-cause mortality is equal to 0.82. There was no publication bias in the study of the effect of monovalent flu vaccine on the risk of hospital and all-cause mortality. They concluded that getting the flu vaccine can reduce the risk of hospitalization by 29% and the risk of overall death by 18%. Therefore, it may be promising to receive this vaccine as a preventive intervention for deaths and hospitalizations. Now, the time for the MCQs. First MCQ is, a 65-year-old man presents with fever, muscle aches, and a cough during the flu vaccine season. He has a history of diabetes and chronic obstructive pulmonary disease. What is the most appropriate preventive strategy to reduce the risk of severe influenza complications, whether in or annual influenza vaccination, use of herbal remedies for immune boosting, avoidance of crowded places only, over-the-counter multivitamins, and high-dose corticosteroids? Which is the correct option?
A.
Yes, A is the correct option. Second MCQ is a pregnant woman is her second trimester asked about the safety of the influenza vaccine. Which of the following is the best response? Whether vaccines are not safe during pregnancy, only the nasal spray vaccine is recommended. Influenza vaccines are safe and strongly recommended during pregnancy. Vaccine should be avoided during the second trimester. Delayed vaccination until after delivery is preferred. Influenza vaccines are actually safe and are strongly recommended during the pregnancy. So option C is the correct one. Third MCQ is a 28-year-old healthy teacher receives an influenza vaccine in October. However, he contracts influenza in January. He expresses concern about the effectiveness of the vaccine. When investigating, it is found that the circulating strain has undergone minor antigenic drift. Which of the following actions by health authorities could best mitigate the impact of such occurrences in future reasons? Whether administering a booster doses of the same vaccine during the season, mm, mandating antiviral medication for all symptomatic individuals, establish the global genomic surveillance and frequent updates on vaccine composition, transitioning entirely to live attenuated vaccine instead of inactivated ones, encouraging natural immunity through controlled exposure to circulating strains.
A.
It's actually C.
A.
As the virus is constantly going through the genomic alterations, establish the global genomic surveillance and frequent access to vaccine composition is the right option for this scenario. Fourth MCQ is a hospital outbreak of influenza is reported among healthcare workers despite high vaccination coverage. Investigation revealed that most infections occur 6 months after the workers receive their natural vaccine. Which of the following factors is most likely contributing to the outbreak and would require immediate public health interventions? Whether waning immunity post-vaccination in healthcare workers, ineffectiveness of vaccine due to improper storage, emergence of an entirely new strain via antigenic shift, lack of adherence to infection control protocols such as masking and hygiene, or the over-reliance on antiviral instead of vaccination. It's a as the 6 months period has been gone through, so waning immunity post-vaccine in healthcare workers is a correct option. Fifth MCQ is during a winter outbreak in a nursing home, several residents developed fever, cough, and myalgia. Despite efforts to isolate symptomatic individuals, the virus spreads rapidly. What's the most critical factor facilitating transmission in this scenario? Whether delayed administration of antiviral medications, lack of vaccination in residents, prolonged survival of the virus on surfaces, close and prolonged contact among residents, or ineffectiveness of rapid diagnostic tests. As they are residing in the nursing home, this is the overcrowded place. So close and prolonged contact among the residents is the correct option regarding this scenario. Sixth MCQ is a 35-year-old woman gets influenza despite being vaccinated early in the season. She is concerned that the vaccine did not work. What is the most appropriate explanation for why vaccination still has a critical role in such cases? Whether it reduces the risk of spreading the virus to others, it eliminates the need for antiviral therapy, it ensures a complete protection against all strains, it significantly reduces the severity of illness and complications, it protects against bacterial superinfections.
D.
Yes, D. She should be concerned that vaccination reduces the severity of illness and the complications. Seventh MCQ is a young researcher working on influenza surveillance discovers a mutation in neuraminidase proteins of the virus. This mutation is associated with resistance to antiviral drugs. Which public health strategy would be prioritized to manage the outbreak of this resistant strain? Whether administer a high dose of existing individuals develop new antivirals targeting heme agglutinin proteins, increasing efforts to vaccinate against the resistant strain, implement strict quarantine measures and focus on non-pharmaceutical intervention, focus on molecular testing to confirm resistance in all suspected cases. In this case, we have to implement strict quarantine measures and focus on non-pharmaceutical interventions that is related to hygiene, social distancing, uh, uh, and other. Eighth MCQ is A 45-year-old businessman frequently travels internationally and inquires about how he can protect himself from influenza during peak flu season across different regions. What comprehensive advice would you provide? Whether carry antiviral medication for prophylactic use on every trip, ensure annual vaccination, practice respiratory hygiene, and avoid crowded places, rely on natural immunity due to prior exposure to influenza, get vaccinated only if traveling to tropical regions, use face mask exclusively during travel. Which is the correct option that to this business who travels frequently?
B.
Yes, B
B.
is the correct option. Yes, you are right. Ninth MCQ is an old man, 70 years old woman with chronic kidney disease was hospitalized with influenza and felt scanty bacterial pneumonia. Despite receiving antiviral therapy, her condition worsens. What is the most likely explanation for the failure to prevent complications in this patient? Whether resistant to antiviral medications, delayed initiation of antiviral therapy, infections of the flu vaccine in older adults, underlying comorbid conditions, reducing immune response, or misdiagnosis of the initial illness. It's her underlying
D.
comorbid conditions that reduces her immune response. And this is old lady of 70 years and also has comorbid conditions. Last MCQ. During an international influenza outbreak, a novel strain emerges, causing severe illness in previously healthy adults. Molecular analysis reveals antigenic shift in hemoglobin protein. What immediate public health action is critical to mitigate the global impact of this strain? Whether rely on existing vaccine to provide cross protection, initiate global vaccination campaign with any available vaccine, strengthen global surveillance system to monitor the strain spread of the impact, focus only on isolating affected individuals in high-risk regions, distribute stockpile antivirals universally.
B.
Yes, it's B. Initiate global vaccination campaigns with any available vaccine. This is the key to the MCQs. This is our YouTube channel by the name of Community Medicine King Edward Medical University, where all the lectures and presentations of the Community Medicine Department from the King Edward Medical University are uploaded there. It is free of cost access. Everyone can go through this channel and watch any video from the Department of Community Medicine. And thank you very much for today's presentation on Awais.
Thank you very much. This is a brilliant presentation. As far as content is concerned, you have presented very well different epidemics and pandemics of influenza and also the surveillance systems, the use of vaccine, preventive strategies. Everything has been covered in a very comprehensive way. However, I have a question that you have shown in your MCQs about surveillance and about the prevention, where you have presented the surveillance system in Pakistan. Would you please go to that slide?
Yeah. When this is the slide is peculiar to the Pakistan, and Pakistan in this it was given about the data analysis strategies and health advisory in Pakistan. And
This is uh, this is an exceptional slide. This is very important for everyone to understand. So I would request Dr. West, would you please repeat the important things that are present in this slide? Because when you are presenting, you have presented it, but I need little elaboration on this slide.
but according to surveillance system in Pakistan, there is no much data was found. However, this is the global influenza surveillance and response system, where it has shown in the figure that there is a national center for the influenza surveillance and response system in Pakistan in Islamabad.
Okay, thank you very much. Here we would stop. See you today, everyone. Allah Hafiz.